Hello there, my name is Sam Yasen. I'm one of the orthopaedic consultants here in Basingstoke. I run my NHS practice through Basingstoke Hospital, but I also run my private practice through the Candover Clinic and also through the Hampshire Clinic. We have a large tertiary referral practice here in Basingstoke. Indeed, by volume of cases done for children and young adults, we're consistently in the top 3 centres across the country, especially for paediatric ligament surgery and especially for meniscal surgery. So I have a wide and complex experience with paediatric and young adult knee injuries. I'm actually dual qualified. I'm qualified in both orthopaedic surgery and in sports and exercise medicine. In my younger days, I did a lot of extra work, let's say, across many degrees. I have an engineering background and an educational background, as well as that dual qualification. I'm currently the research lead here at the Department of Orthopaedics in Basingstoke, where I head up a team looking specifically into knee injuries across the entire age spectrum, but with a particular focus on paediatric knee injuries. In addition to that, I'm a surgical tutor, and Basingstoke itself is a recognised international and national visitation centre. So we have surgeons from around the globe coming to visit us, not only to watch surgery, but also to learn and participate. And indeed, I run and co-run several courses, either through Basingstoke or further afield, where we teach surgeons many of the techniques that we employ here in Basingstoke. The most rewarding aspects of the job are always the outcomes for our patients. The ability to intervene in a patient's life for the better can't be matched by any other experience, and that really is what keeps us going through the good times and the bad times. I think we've all been through a fairly rough ride on a global scale recently with COVID, and I'm glad to see that we're back up and running these days with surgical services, and we can once again be in a position to help those that are most in need of our help. I think what really makes things unique for coming to see an individual like myself and coming to be treated in a centre like Basingstoke is I take a very detailed and conscientious approach to each and every patient. There is no one-size-fits-all here in my practice. Each patient is assessed in a detailed biomechanical and clinical manner, and any prescription, be that a non-operative prescription for rehabilitation or exercises, or indeed an operative prescription, is what I would term an a la carte prescription for that individual. So our solutions for individuals are tailored to the individual. The additional facility that we have here really in Basingstoke, due to the volume of surgery that we undertake and our specialist focus on paediatric and young knee injuries, is we have a whole portfolio of options that may not be available elsewhere in the country. Indeed, as far as I'm aware, I'm the only surgeon currently in the UK who is permitted to take a tendon from an adult and transplant it into a young child's knee. A very specialist service that is available both here and also in Sydney in Australia. So there are various tailored options that may be appropriate for you as an individual, or indeed for your child, that may not be available elsewhere in the country. And I think that combination with the approach we take really puts us in a very unique setting.